Dr. Ajay Sharma is a pediatrician who's worked in London for the past 20 years, working with children who have developmental disabilities. Thank you so much, Dr. Sharma, for taking the time to have this discussion with us. Are there factors during pregnancy that can either help or hinder an infant's development?
I think that's a really important point, because people think that children start developing after they're born. Children are developing from the point of conception throughout the pregnancy. And there are some things which are particularly important. Firstly, I would say it's the nutrition of the mother. That needs to be good. The mother needs to have good amount of protein, iron, calcium in her diet. And if there is any deficiency, that can be easily complemented, very easily given iron tablet, calcium or multivitamin to the mother. The second is about the stress. And maternal stress during this time directly affects the fetus. And people around the mother needs to take care the mother is not too stressed. Also, the mother needs to stay fit, needs to take care of her own fitness. The next thing I feel is the health of the mother. It's really important. The mother needs to have checkups done with the doctor to see that she hasn't got any thyroid deficiency, any diabetes or any high blood pressure, and if any of these things are there, they need to be treated. And lastly, a really important issue is that the mother should not take any toxic substance during pregnancy, such as say alcohol or smoking or any drugs. And if there is a need to take any medicine during this time, I think it's really important the mother says to the doctor that I'm pregnant and checks it whether or not any of these medicines are going to harm the child or not.
Why is family's involvement important for a child's development?
That's really an important point, because children love their interactions with the primary caregiver, and they learn communication interactions from that interaction with the family. The other thing is that children develop attachment with the primary caregiver, which is usually the mother, and then they develop attachment with other people. And children who miss out on that opportunity of developing attachment with their mother in the family, they have long-term mental health difficulties. And the other is that children are learning about their social interactions, about their language from the interactions that they're having within the family. And that's what's giving them a sense of self-confidence. And children who have grown up isolated or without the right attention from their families, it's been shown in studies of orphanages survivors that they have long-term difficulties.
What's the importance of play in a child's development?
Play is really important, because play is the time when children are having fun and they're also practicing. And that's really the best way of learning, when you're having fun about something and you practice it. While they're playing, children learn about objects, how objects work, how they move, how they relate with each other. So they're learning about this world. And when children are playing, they're also learning about imagination. They're imagining things. Their imagination is getting stronger. They're also interacting with other children, and they're learning about how to interact, how to be with other people in this world.
How do I work towards my child's social communicative abilities?
I think the first thing is to try to have fun with your child while you're playing with your child. And that's really the most important thing, because that, as I said, that's the time when children are really learning. Try to create situations when the child gets an opportunity to play with other children. And because they're learning from other children, they're having to negotiate situations with them. Try to use stories which have other people negotiating, interacting, and explain to your child what is happening there, because children are learning from that too. But remember, have fun with them. Don't try to teach them how to interact with others.
So this is my first child, and I don't know if the child is reaching the expected milestones. So what do I do, and how can I get the milestones assessed?
I think the first thing I would say is talk to people who work with children, like teachers, nursery teachers, or therapists or psychologists, and ask them about it. There is a lot of information available on websites and other places where you can look up and see how child development progresses. What I would advise is not to compare your child with any one other child from some one other family, because there's such a wide range in children's development. There are no two children who are developing in the same way. If you're still worried about it, then talk to a pediatrician or child psychologist and get your child checked over.
Once I notice red flags in my child's development, what do I do and how do I respond?
But I would advise to get your child checked by a pediatrician or a therapist or a psychologist, and just make sure that you get your child's hearing and vision checked. Ask the therapist or the psychologist what you can do to help your child development and do those things. And then give about 6 months, work on those things and give about 6 months and get your child checked again after that time.
Does every missed developmental milestone a cause for concern for parents?
No, not really. No. Because the way children are developing, not every child is developing in the same way. There are some children who, once they start sitting, they don't crawl. They just stand up and walk. If the child has missed a few milestones, then perhaps you need to think about it. What matters is the whole development of the child. So keep your eyes on that rather than on any particular individual milestone.
How do I know who's the right kind of doctor for my child's developmental delays?
I think you should, first of all, you should get your child checked by a pediatrician or a specialist, developmental pediatrician. You could also ask a child psychologist for help here.
How will my child's development be assessed and screened by my doctor?
First of all, your doctor will ask about your concern. So tell your doctor everything that you're concerned about your child's development. Then your doctor will ask how your child has been developing so far. So tell your doctor about your child's progress so far in language, communication, social interaction, and daily activities like eating, toileting. Tell the doctor about your family and about any concerns in the family. Then your doctor would observe the child. They will use developmental tests to see how the child is progressing. And then the doctor will physically examine your child, and would also check hearing or vision to find out whether there's any problem or not.